Hello, this is Dr. Brandt Gibson, and I want to talk to you today about tendon tears. In some of the previous discussions, we talked about Achilles tendon tear, but this is the other tendons. A lot of times you can get a tear in a tendon. It could be a small inner substance tear, a tear that's right in the tendon itself. You can get a transverse tear where the tear could be partial or complete, and the treatments are different. If you have an injury to a tendon, it is important that it be evaluated. Tendons can be evaluated in really two ways where they can actually look at the tendon. One is an MRI. The other is ultrasound. A physician that has good control of the ultrasound can usually give you a good idea whether it's a tear or how bad the tear is, and oftentimes doesn't need the MRI if they can do an ultrasound. Depending on the extent of the tear, sometimes I will send them for an MRI anyway to say, is there additional injury or there are additional problems that we need to look at, because it's a more complete image of the tendon in that way. If you have a complete tear of a tendon, there's really just one way to treat it. You should go in and actually repair that tendon to get it back to normal. If you have a partial tear, sometimes, depending on the age or activity of the individual, you can actually treat it conservatively by putting them in a boot for a extended period of time and giving it time to heal, although a lot of times it will require surgery. If you have an inner substance tear, conservative treatment is usually started and attempted first to see if it can get better, or you can do surgery. Some of the conservative treatment may be putting in a boot, protecting it, splinting it, or you can actually do an MLS laser treatment. The laser will actually cause it to repair itself, and oftentimes can repair these small inner substance tears. If it's a larger tear, often it may require surgery as well. In all cases, we basically repair the tendon and can usually get people back to functioning pretty quickly. So really what it comes down to is where the tendon is, what it's doing, and how bad the injury is to decide what needs to be done. So if you have an injury to a tendon, if you have weakness, or if you have an inability to do something you usually could do, it's important that you get this evaluated to decide, do I have a tendon tear? And once it's evaluated, then you can know what the best options are, whether it's conservative treatments, whether it's just protecting it for a period of time, or whether it's something that does need to go get surgery and get it repaired. In all cases, if you're treating it correctly, you can get back to normal activities, and you can get complete healing of that tendon over that period of time. This is Dr. Brandt Gibson, and this is your podiatry tip, day 37.